inches, 20 centimeters. They went, yeah, okay, 15 centimeters. They changed it. We didn't pick it up. I have to pay another $300 for my other things that we need. And then we could get our lumber. You still looking forward to that, man?
Hey, man, you want to save you, or you want to go for?
No, let me finish with him and I'll come up on the turn. Okay.
Hello, everyone. Thanks for joining us. Thanks for liking the live, Miss Michelle. We appreciate it.
The great thing about having two plastic surgeons is you shorten down the time.
Today we
First of
are
all, there's a plastic and cosmetic surgeon.
doing our last surgery of the
Can't do
day,
cosmetics.
and it happens to be our longest surgery. So our patient is doing a what Dr. J would like to call a super mommy makeover in the front with a BBL.
And it helps to have a nice group like that.
So it's a lot happening today. Today's procedure is going to take about 3 hours. We have Dr. Phillips as well, who's operating alongside Dr. J today.
Jersey Shore either.
They're getting started with some lipo, so they're just extracting some of the fat around our patient's body. And then we're going to take that, and then hold on to it and put it in the butt.
payments for his fees.
We had a few surgeries earlier this morning. We got started bright and early around 5:30. So we've had 4 surgeries today in total. This is our 4th and our last of the day. We are also live on our YouTube today. So if you guys want to see what this surgery looks like from my perspective, or what the surgeons are doing themselves, you can hop on over there at Dr. Jeneby Plastic Surgery.
So the other day
And you
when
will
I went
see
down to Cancun,
not only
I wore a shirt, GTL,
Dr. J, but you'll see a few other doctors listed there.
And it said that, and some dude passed me and was taking his girlfriend. It's like, that is the coolest shirt.
Michelle asked, what will the recovery time be? Great question. So our patient today, the one that we're covering right now, she's getting a lot of procedures done at once. So her recovery time is going to take a little longer. So it's going to be about 4 to 6 weeks where you don't want to be doing a lot of activity, but after those 4 to 6 weeks, she'll be able to start picking back up where she left off, but still maintaining life. Being mindful, still taking it easy, not overdoing it. But it's also just going to depend on her and how she's feeling as well. But generally, most of our patients, full recovery will take a few months. So like for scarring, returning like to completely back to normal. But in order to start like functioning normal, about 4 to 6 weeks. So I hope that answers your question. If you guys have any more, feel free to just comment those down below. Of course. And there should be a pinned form here on this live. If you're curious about any procedures yourself, or you know of anyone who's curious as well, you can have them, you can either share this live, you can fill out that form that I have pinned anywhere on the page, or you can hit one of the links that I have pinned on Doctor's in the doctor's bio. It's going to be get a quote, and you can fill that out. It's just going to ask for some of your information, what you're interested in. If you're curious, we would have somebody reach back out to you and answer any questions that I couldn't answer. What surgery is being performed today? Great question. We are doing basically a super mommy makeover today. So what that entails is we are doing a tummy tuck, we are doing lipo 360, we are doing renuviante, we are doing a BBL, we are doing a breast augmentation and reduction. So it's a lot going on. We got started on the lipo 360 portion of today's procedure. So right now our patient is laying on their front side, so their stomach down. And we are, well, Dr. Jeneby and Dr. Phillips, they are taking the fat around our patient's sides and her back. And we're gonna hold on to that fat. It's just being collected right now. And then later we're going to inject some of that into her butt. Wow, yeah, it's a lot. Today's procedure is gonna take about 2.5 to 3 hours today, maybe, give or take, maybe longer. Great question. And like I mentioned earlier, for those of you who are just hopping on, we are live on our YouTube as well. So if you guys are interested in seeing what I'm seeing, if you guys are interested in seeing the surgeons, go ahead and hop on over there. You can watch and see what this surgery looks like. Of course, there's going to be like blood and like nudity, so just keep that in mind. It's going to be at Dr. Jeneby Plastic Surgery, and then you'll see a few other doctors' names listed there as well. Like Dr. Phillips, you'll see Dr. Bam.
This takes a long time.
Dr. J, where are you from?
I'm from DC, Northern Virginia.
Okay. DC, Northern Virginia.
Nova.
Nova?
They call it Nova, Northern Virginia.
Oh, you from the DMV?
Huh?
You're from the DMV?
Where's that?
The Detroit, Maryland, Virginia
Yeah,
area?
I'm from
Where are y'all from?
Alexandria.
Oh,
And
nice.
McLean.
I live in Silver Spring right after college. So.
Oh, did you?
Yeah.
So I'm across the bridge.
Yep.
In McLean.
Nice.
We live actually
Is
across
that
from
where
the
he
CIA.
does surgery?
Yeah.
No.
That's crazy.
McLean.
Dr. Jeneby performs surgery here in
Then I did all my schooling
San
in
Antonio, Texas, in the Stone Oak location,
Yep.
here at Maximus Surgery Center
That's why
in
Dr. Phillips
Chrysalis.
and I get along. He's such a northerner.
Callie
Phillips
here.
is as Texas
Awesome.
as it gets.
How's the weather over there?
See all the fat we're getting here? All that will be
Hot.
brought back into the
Ah,
patient.
yeah.
Into the buttocks.
It's hot here too.
Create a
More
little bit of
humid than anything else.
A mound.
I feel like you're walking in a cloud.
And contribute to her projection.
Well, how's everyone's day going? Today is Wednesday over here for us. We're on our fourth surgery of the day, our last surgery of the day, and our longest surgery of the day. So if you guys have any questions about what's going on, feel free to comment those down below. We're doing what Dr. J likes to call a super mommy makeover on the front, and then we're going to be doing a butt lift as well. So feel free to comment any questions you may have about today's procedure.
It's going to be hot though.
We're not going to be here for the entire surgery. We'll probably come back later. Come back at different points during the process.
Well, they're on spring break now. I mean, on summer, I'm sorry.
Hey Michelle, thanks for joining us on YouTube. And so Dr. Phillips and Dr. J, they are still taking some fat out from our patient's sides. So around her back and the sides of her body, they're still collecting
500
some of that fat, and
500
then
hips.
they're gonna go in later and inject it into her butt. So we're still working on her backside still.
No. Get yourself a priority.
How's everyone's day going so far? Anything exciting?
It's actually
Anything interesting going on today?
Yeah, but then you gotta sit on
And again, we are live on our YouTube as well. So if you guys are interested, you can hop on over there at Dr. Jeneby Plastic Surgery. You'll see a few other doctors' names there. And on that platform, you'll be able to see the surgery happening.
Frontier seems to be the front runner.
So we have Dr. Phillips and we have Dr. J operating today.
Nobody's fool, nobody's fool. No. Nobody's fool, nobody's fool. Never, nobody's fool.
Hi, thanks for joining us.
Are you gonna give the claw enough fat to like?
Yeah, you're good. Huh?
No.
Oh.
For her, you're gonna give the claw.
Oh,
enough fat to,
yeah.
do
I
that
mean,
thing?
usually, she didn't want to be too big, so this will be, at minimum, maybe 1,000 per side. That's a lot. So, to put in perspective, somebody wants a smaller medium, it's between 300 and 600 a side. Well, this is bad.
And you're just above the muscle, or is there?
How does this work? It's just 300, 500, I'll start this. Say that again?
So you're just above the muscle?
Yeah. This.
Yeah.
Oh, you have to in our world in BBL to stay safe. You stay up literally above the muscle,
Gotcha.
and it's all done by. For us, I've been doing this so long. It's kind of a feel thing.
Copy. Now, is there like is the machine the tool you're using special to not puncture through?
Yeah.
Or-
This one actually is it's got a blunt tip, squared off tip.
Okay.
Great questions.
Mm-hmm.
Hi. No, it feels great.
Lies.
Guys, I said.
You need a crossover.
What he's doing is when we get to, you see how we get to follow ourselves. Kind of like how you duplicated yourself yesterday. Another guy.
Yeah.
I mean, could you have done all of it yourself?
Yeah.
Sure.
But it would have taken.
It would have taken a lot longer.
And I would have missed something.
You would have missed something here, so I'm duplicating myself here. Then I'm going to follow him. Eventually going to follow each other with this heating lipo. And this can be done in roughly half an hour. It would take an hour and a half by yourself. So that's my insurance if I were you. See, what is your code? These code searches. That's weak. You gotta get to the doctor's. They're great.
Is there gonna be a lot of bruising after?
This could
Someone
be,
wance to know.
So everybody bruises at a little bit different rate.
Yeah.
No. Obviously, Dr. Hernandez and I have already countered some of the bruising because we gave her 2 drugs at the start of the case that help with bleeding.
Also, we have to take the harness.
Yeah, we have to take stuff before surgery and after for bruising and swelling.
Okay.
So we try to mitigate that. And worst case scenario, if we see a lot of bleeding here, we'll bring that machine in and recirculate the blood.
Okay.
And give it back to her. No, I don't think almost any places have one of those here in town with the safety. Also, we like to get your hemoglobin beforehand.
Very hard. Right on my back.
2 minutes arm.
2 minutes.
Yeah. 2 minutes arm. We'll do 2 minutes other arm. So if somebody has a low hemoglobin, like we always get labs before, and our nurse practitioner checks it, and anybody under 12 and a half should let us know. Or anybody that's sick, she'll call us. And we're one of the few places also that instituted a heme infusion program. So people who have anemia, they come in here, and our nurse will give them iron IV. And that tends to work better than oral IV. Much better, and faster. So you can get a 1 to 1.9 unit jump in hemoglobin in about a week and a half. Whereas that would take you 3 months orally.
Oh wow. Okay.
So we do a lot of things ahead of time to strategize and make for patient safety.
Perfect.
You see how it's getting more yellow? It's because now the epinephrine has been sitting on this side a little longer. So So as the adrenaline and epinephrine, it's starting to constrict the vessels even more.
Mmm.
Exciting. You made a yummy sound. Kind of like, All right. So anyway, we do a lot of things that benefit the patients here.
Good. Thank you.
Very few places, and we keep them overnight in our facility,
Yes.
which is very hard to find in the city.
Yes.
A lot of times surgeons will send people home, which is fine, I guess, but man, you're relying on your family to be like a...
Is there a birthday party happening?
Yes, there is. Yes, there is. It's Maury's birthday, the girl who's just down here.
Gotcha.
And we got my favorite cake.
Aww.
Oreo cake. That's a champagne Oreo cake. Champagne, you know whatever cake you want.
It's an Oreo cake.
Huge fan.
Oh.
Oreo ice cream.
Oreo ice cream cake.
Oh, dude,
Oh,
you're a legend.
I
Oh, yeah. Can't go wrong.
My wife likes red velvet.
Yeah, me too. My wife loves red velvet.
Yeah.
Hey, thank
Probably
you
cooks
guys
it.
for joining.
Yeah, you're right. She does.
We are with
Try to
Dr.
cook anything you
Phyllis
want.
and Dr.
Yeah, it's
J.
fantastic, I'm not gonna lie.
We are doing
She's not a
a
pastry,
super
right?
mommy
She's
makeover,
She's a pastry
as Dr.
and
J
a
likes to
cuisine
call
chef.
it.
Oh, wow.
And then we're
So I
going to
get
go
the
in
best
with
of both worlds,
a
yeah.
butt lift. Right now we are doing lipo 360
She
right
made
now.
You, beef Wellington?
You know it.
Oh,
Yeah.
what a decadent
That's
treat.
amazing. You know, my favorite is duck confit, you know?
Oh, duck confit is
Yeah,
beautiful.
can't go wrong with that. Yeah, no? I love that.
His wife is a chef in Paris.
Mm-hmm.
No, you didn't say that. What?
Oh, yeah.
Lucky?
Yeah. So, that
Paris,
part.
Texas.
Yeah.
Lucky?
It's like a guy at Brunevion.
Yeah.
Because he came in as He goes, I live in Monaco.
I like have pictures of like every meal I've ever eaten in the last like 3 years, and it's just like retarded.
Oh my god.
My dinners are like Michelin star, like crazy.
No, that's crazy.
Yeah. Like, I asked for like if I get like, oh, she's like, I'm gonna make a sandwich. You want one? I'm like, yeah. It'll show up like a picture you took at a billboard. You know?
I believe it.
It's insane.
Wow, look at you.
Yeah. That's good.
Life's good. No complaints.
Outside of Houston, called Morton Community Theater.
Oh.
And my dad is like,
Hey everyone, thanks for joining us. Thanks for coming on this live.
Okay.
Again, we have Dr. J here operating and Dr. Phillips at Dr. Bam on TikTok if you guys want to go check out his page. We are also live on our YouTube if you guys want to check that out too. It's going to look a little differently than our TikTok. The live on our YouTube is going to actually show what's happening, what's happening to the patient, not just me like iterating what's happening. So if you guys are interested, definitely go check it out at Dr. Jeneby Plastic Surgery on YouTube. And then you'll see a few other people listed in our name. And so if you see that, then that's how you know you're in the right spot. But it's the profile picture is gonna look the exact same as Dr. Boom Boom Pow's profile picture. So just keep that in mind when you're looking for it if you want to hop on over there.
Is that what he says? He's 6 minutes?
I don't know what that, like he has like some time on it. Like more than 6 minutes or more than 6 people.
Hope everyone's having a great Wednesday. It's our last surgery of the day, and it is our
I used to have
longest.
more here and I got rid of them because they turned out to be therapy sessions.
Right.
So if you guys have any questions about today's procedure, or you know of anyone who has questions, go ahead and share the live if you'd like, or comment down your questions below. Be happy to answer them. We have both Dr. Phillips and Dr. J, so we can ask them y'all's questions if you have any.
And they could be companions.
Alright.
Right?
Yeah, I'll be back with the next sentence.
Yeah, we're going to flip over.
We're gonna flip her over and all that.
Yeah, yep. We'll come in a minute.
ETA. Okay. You got
Probably
it.
about 20 minutes.
Alright, perfect. I'll be back.
Wow.
Nobody's fool, nobody's fool. Oh, you did this? Oh. Okay, Philip's in here. He's the chief medical officer. Okay, Philip.
So if any of y'all are interested, you guys can. If any of y'all are interested in the procedures that we have, that we offer here at Maximus Surgery Center, you guys can fill out that form that I have pinned on our TikTok. I know it's pinned here on Dr. Phillips. We've been having some technical issues with setting up that form that I'm talking about. So if you guys see like a blue little dot, go ahead and click on that. You can fill that out. It's just going to ask for some information from you. You can submit it and somebody can reach out to you and answer any questions you might have that I couldn't answer today. We will take a break here shortly just because today is a longer procedure. So if you guys want to come back later, feel free to do so. We do have to flip our patient onto her other side later to finish up today's procedure. So like to do the tummy tuck, to do the breast lift, and all of and the rest of our lipo. We'll have to flip her over to do that. So we'd have to like step away for a few minutes. But we still have a little bit of time before then, so feel free to comment any questions.
In the store that was open from 7 to 11. 7-Eleven. He was trying to be laughed by his competitors. He said, how can we get our competition by, you know,
thanks for joining us.
Undercutting 7-Eleven.
And for those of you who don't know, we are I'm live on two different doctors' accounts. So we have Dr. Phillips and Dr. Jeneby, so Dr. Boom Boom Pow, Dr. Pam. You guys can check each other's pages out. They work together. So on days like today where we have a really long surgery, if it was just one surgeon, it would probably take just that surgeon alone up to 8 hours to do everything that we're doing today. But since there's two plastic surgeons here today, it's going to shorten that time significantly. And of course, with all like the techs that we have, the surgical PAs that we have, it's going to make this process go a lot quicker. So if you want to go check out Dr. Phillips, you can find her at Dr. Bam on TikTok and on Instagram. Go ahead and show him some love.
I try to romance this a little. I try to light the candle for her.
We do have some specials going on, so if you guys are interested in those, check them out. We have them pinned on all of our social media platforms. It should be one of the first posts that you see when you get on to our social media and you start looking at our page. It's going to be one of the first things that you see.
Oh, man.
Oh, thanks for liking the live. We appreciate it.
Oh, just a big gulp.
How's everyone doing today?
Hi.
Oh, that was because Garrison was initially an ice cream shop.
Unless you are a plastic surgeon, board certified plastic surgeon, I don't think you can join. Sorry.
Athens, Georgia, I think. They were starting to put Snickers and shit in there.
For those of you who are just hopping on, we are doing what Dr. J likes to call a super mommy makeover. So what that all entails is our patient is getting a BBL done today, lipo 360. She's getting Renuvion today. She is getting a breast augmentation and reduction, so it's going to end up lifting her breast. So a breast lift, you could say, and a breast augmentation. And she's going to get some exosomes. And what that is like stem cells added to our patient's fat that we extracted. And it's going to be injected into her butt for the BBL portion of today's surgery. And basically what that does is it helps the fat cells get blood to it, because it feels like, or get like it helps those fat cells survive, basically, because when you're taking fat from one part of the body and injecting it into another part of the body, it's like drowning in blood, basically. So those exosomes just help it get oxygen.
Wonderful. It's wonderful stuff. Told you a lot, teaches you a lot about business strategy, marketing.
Hi, thanks for joining us, guys.
I tell Hernandez at least one of these stories a week.
Again, we are live on our YouTube. If you want to check it out at Dr. Jeneby Plastic Surgery, and then you'll see some other doctors listed on there as well. And it's going to be the same profile picture as the one here on TikTok. So go check us out over there. There you'll find the surgery happening from my perspective. You can see the surgeons operating themselves. Of course, you are going to see some blood and some nudity, so that's stuff you wouldn't see here. So just keep that in mind. Hi. We are going to take a break pretty soon here.
Yeah, we're going to take a quick break. We're going to turn around. Oh, yeah. Wait, I do get into it. Whoops. All right, let's go.
All right, y'all. Thank you guys for tuning in for the first part. We'll be back later.
Thank you.
Tune in.